In this video, I'll show you our recently built West St. Paul location in Minnesota. This particular project is about 5,000 square feet and has 12 dental chairs inside. But as I go in and explain our floor plan, we have to wonder, what is a good dental floor plan? Is having a really big waiting room for patient comfort the main priority? Or perhaps it's having some nice conference rooms for your team to enjoy? And that is totally up to you. There's no perfect floor plan, though based on what you're going for, you can create that beautiful office that makes sense to you. For us, we design for the volume of the patients we can see. So before we even start creating a floor plan, we make sure we have enough square footage of a lease space to add in the amount of chairs we need, all while creating a balanced office. After all, we see a whole bunch of patients and we need those operatories in the dental practice. So it's not the big waiting rooms or those fancy high-end dental gizmos that's going to bring in the revenue you need to pay off your practice debt, student loan debt, and life debt. It's quite literally having the patients come in, treating them, and then going to the next. But with more operatories, the more you can multiply your revenue by the number of operatories. Or, simply put, one of the main drivers for revenue in your business will be the number of dental operatories. So pro tip number 1, plan your dental office priority first before randomly drawing a floor plan. And with that intro, let's take a look into our CLD floor plan. So this is our floor plan for our West St. Paul office. I will explain step by step of what we put in here, and as we go through this, you'll know exactly what kind of rooms you'll need to build your dental office. First, you'll see the entrance where the patients come in. Then the arrow points to the front desk. This is where they will check in. Once the patient checks in, they're going to be seated in the waiting room. But the waiting room chairs aren't the only things that we have in there. If you look here, you'll notice that there's a yellow and green highlighted area. The yellow highlighted area is our display case where we put all of our CLD products on display, and the green is the patient restroom. We had to place a patient restroom because 1, it's required by law, and 2, well, it'd be kind of weird if we didn't place a restroom for the patients. But one thing I just have to mention, and this is going to be one of those obvious things, but I have to mention it because, well, apparently dental business owners do this. They make a huge waiting room, and for what? Previously in my other video, remember how I mentioned that I bought a 4-chair dental office in downtown St. Paul? Yeah, so if you combine the space for the 4 chairs and the waiting room is bigger. Yes. You heard that right. It was one of the most interesting things I've seen in dentistry. There is absolutely no need or reason for that. We contemplated building 2 more operatories in that office, but ultimately we decided to just let that office go and just create a bigger and better office. So pro tip number 2. Don't make a big waiting room. The trend back in the day, I guess, was to make a really big waiting room and put fish tanks in. I don't know why. But lately, I'm starting to see the opposite of that and dentists making really tiny waiting rooms. So what's the golden ratio? Well, how I determine how many waiting room chairs is to 1.5 to 2x my operatory chairs. So as long as you can fit the waiting room chairs in there, then I think it's a good place to start. Next, the patient goes into the hallway towards the operatories. But before we go there, I'll explain what we have in each room. Highlighted in green, we have our team member restrooms. As you know, there's a much higher ratio of women versus men in dental offices. So we didn't make 1 female, 1 male restroom. Instead, they're both unisex. So, pro tip number 3. Make restrooms unisex. This will save your team a lot of struggle waiting for a restroom during break. Oh, and something I also learned. Don't put a urinal in these restrooms. I didn't know, but apparently it offends a lot of people. So, it's just best not to do it. Next, we have the item in blue. This is where our assistant managers are stationed. They have daily tasks they need to complete, and they're also able to help assist any team members or patients. Next, we have our wet lab highlighted in orange. Denture model pouring and other lab-related work are all completed here. One thing to note would be that you will need plumbing and water to go into the wet lab. Dude, I just realized while recording this video why they call it a wet lab. Anyways, moving on to the yellow highlighted portion. This is our dentist room. We put this room in here because it's closest to the operatory room. Each step makes a big difference. And lastly, the dark pink highlighted area is the storage room. In business, everything that you don't use often should be placed far away. Only use it when needed. In our mind, that would be the storage room. Alrighty, now it's time to go into the operative side. This is where you'll see the magic happen. As a bonus, I'll also upload our operatory photo later in this video as well. First, we have the panoramic room in light blue. So why do we have a panel room at the clinical entrance. What possible reason could be as to why we put a panel room before the operatories? Well, the answer to that is to make sure we take radiographs first before entering the operatory room. Imagine you had to walk all the way to the operatory room and then you had to get up and walk all the way to the panel room again. Too much walking, too much traffic, it's just not smart. So pro tip number 4, place your panoramic radiograph rooms right before your operatory rooms. This will save you lots of traffic and bottlenecks. Next, highlighted in yellow is our sterilization room. If you notice, we have a separate entry and exit. This is done on purpose as we don't want our people running into each other and creating a bottleneck. Years of building dental offices definitely helped us learn this one. So pro tip number 5, create a separate entry and exit for your sterilization area. This isn't really hard to create or do, but it will make your team a lot happier. Next, in orange, we have our mechanical room. It's boring yet important stuff. This is where things like boilers, washing machine, amalgam filters, vacuums, air compressor, and other stuff like that goes. But it leads us to our pro tip number 6. Soundproof your mechanical room. And you really do want to soundproof it because it will drive whoever is in the next room super insane. Well, I guess some people might get used to it. Who knows? Now we have the operatories in green. Why green? Because this is where you will make all the money. That, and I was running out of colors to use. Anyways, with our systems, we tend to find that 12 to 20 chairs being the best for what we do. And sure, it may be different from what everyone else does, but that's what just works for us. Oh, and if you're wondering what this dark pink room is, it's the sprinkler room. Apparently, that's where the control for the sprinklers are. The patient has finished his or her treatment and is now ready to leave your dental office. If you notice, there is an entry one way, highlighted in orange, and an exit door, highlighted in yellow. This is done on purpose. And this is also very important. This will prevent bottlenecks and people bumping into each other. So pro tip number 7, create a separate entry and exit for your patients. And this is good for several other reasons. Back when I first started, we had a common entry and exit in our waiting room. Angry patients, and by the way, all clinics have those from time to time, would go to the front and start causing a scene or whatever. Not cool. And after making this change, the angry ones will just walk out the door. So it's all good. Just something I picked up over the years. But I'm sure you're aware that there's more rooms to talk about. So here we go. For our team members, we actually come in from the side of the building. I don't know why, but it just feels like we have those in most of our clinics. It's not 100% needed though. In yellow, we have our billers and patient care coordinators. So one thing about us is that we don't really have a front desk that does everything. Everything meaning front desk doing the billing, calling, scheduling, checking patients in, etc. We find that it's way too difficult to train, and if you lose someone, then you have to train them all over again. Breaking down the tasks into specific roles makes it easy for our new hires to learn our system. Anywho, the blue is where our greeters sit. They are the face of the clinic and check people in. And in green, we have our break room. So, why is our break room so huge? Well, it's because we're so cool. Ha, joking. But not joking. But the real reason is that we hold our monthly meetings, food parties, baby shower parties, potlucks, and everything else in here. Plus, people eat here. It's not absolutely necessary to have such a big space, but that's what works for us. There are different types of dental offices. I think traditionally, most are closed concepts where they have a closed room and patients just enter in there. It would be a closed office and there's maximum privacy. And then, on the other end of the spectrum, there's open concept where there's not even a barrier and, yeah, not cool. Now our dear friend Fred is exposed to the orange man. Plus, there's more chance of a HIPAA violation. So yeah, not for me. But as long as people do it right, I'm sure they will be fine. Here at Clear Lake Dental, we have the middle. The Goldilocks of the concepts, if you will. Oh, and by the way, this is our Robbinsdale clinic. I couldn't really get a good photo in time for our West St. Paul office. But our first Scratch Start dental clinic, in this case, Robbinsdale clinic, is looking nice. Dang, the memories. So now we have this floor plan, we need a construction crew. So click on the next video here and it will direct you to our construction crew. See you there.